questions, examples, society at large questions. What the challenges have COVID-19 caused on you as a person and to your community? This could include examples such as accessing food and other household items, accessing health services, mental health, well-being issues, jobs and employment, housing and homelessness, support for older people, domestic violence, family relationships, women and girls issues, loneliness and disengagement, support of disabled and vulnerable groups, digital access and skills, access to cultural and spiritual support, language and religious due to lockdown. This is under what the challenges. We have these issues. If anyone faces one of those from us as individual and as a community, all together we discuss it. And the second is what is being done to help you and your community address these challenges. So what was our reaction to this challenge? And third, what do you think should be done that is not being done to address these issues? Yeah. If so, what do you think? What we should do if there is any issues we didn't address it in from the challenge? So what should we do? Okay. As a person, as a community, be helped to address these issues. So the helps you, God. The help is also we speak about the helps we got to solve these issues. One of the issues or the challenge that we face. So this is what we're going to discuss, inshallah. Okay, let us see. What about, did you call Ahmad al-Masri?
Yeah, he hasn't answered the call.
No problem. What about Abdul Hafiz? He's not.
I
so
think
can we start?
Abdul Hafiz has joined the call, so I guess we could make a start.
Abdul Hafiz, join. Abdul Hafiz join us, so we can start, inshallah.
Yeah.
So first of all, we want to introduce ourselves. So we do introduction.
Yeah.
Okay. If there is anything you don't understand, guys, you can ask. Or if you want any translation, we try to translate. We do mix. Yeah. Inshallah, I will start by myself. My name is Abdurrahman Saleh Mahmoud. I am the chairman of the Awate Education Center. Zadin, go ahead.
Yes, my name is Zadin Osman, a resident of Nottingham, and I'm one of the managing committee in Awate Center.
Hello, my name is Muhammad Hussein, and I am one of the team management in Awate Center.
Yes, my name is Mahmoud Yassin, one from community staff.
Discussing one by one, just it will be open. Anyone we can jump to the mic and he can speak when it's ready about the challenge as individuals that face as individual and as a community we can speak as well. Anyone, I will leave the platform for you now. You can start, anyone. If
so speaking about challenges, yeah, I think this COVID-19 crisis had it's been a huge challenge for all of us, not just for me as an individual, but as a community member, as a member of Awate community. I remember prior to this COVID-19 crisis, we used to open the center on a daily basis, and we had this meet to greet events. We used to meet people from different communities. We used to share our ideas and our stories, and we had that, community centers where we used to interact and get to know each other more. And this crisis somehow did stop us from having that that feeling of togetherness. So we don't meet community members anymore, and that kind of feels like you are left on your own, and you don't get the support that you need. So we used to have like support from different support groups within Nottingham and outside Nottingham. We used to run different projects. We came across some interesting individuals and communities as well, but this crisis had actually blocked us from having that life that we used to have before. So in a way that it made us, get more isolated and not being able to speak to the people that we used to have a normal conversation with. So it's been a huge challenge, and I think it had a negative impact on our center and on the services that we used to provide. So I mean, I could speak about a lot of challenges that we faced during this period, but I'm gonna give chance to others to share their story. Then we can take it from there. Or to health services, have you, for example, have you had a problem and then you had to call, NHS, and they couldn't, you couldn't get the support that you need because of this, because hospitals are quite busy with this COVID-19 patients, and if you have like a disease or if you have like a symptom which had nothing to do with COVID-19, do you think you're getting the attention that you need? I mean, if you have an example you could share with us, have you faced any difficulties reaching out to?
No, I don't have any difficulty.
Okay.
Yeah.
Okay. And others, maybe Muhammad Hussein or the rest of the team?
I think we all of us like there's no one. We have just one. He get the coronavirus and he was just self isolation. But
Yeah.
in terms of others, all of us we are well.
Yeah.
And after that, like I just want to say like how difficult was like 2020 with the coronavirus. Before that, we started at the community center on June 2019. So we are like was new when we started the center, and after that, we tried people was coming from different community and was sitting there and getting our coffee. And after that, coronavirus came. We tried to close by the government guidance. We have to follow that. So everyone are meeting the community center members, and in terms when we are working, we take a break there for 2 hours, and after that it was like a home for us, and it has been closed now. And in terms now when I go to work, for example, myself, and I just have to work like 3 hours and back. Before I was trying to work 3 hours, and after that get a break like 2 hours there, sitting and have a discuss with the friends. After that, there's no, it's closed now, so I just need to go like for 3 hours and just back home and sit alone. So which has like effect of this to me and to others as well. Like some people ask when Awate is gonna open, and as we all know, we don't know when we are gonna open it. So it has a lot of impact, well, in all of us.
Thank you, Muhammad Hussein. Okay, just I'm going to have a go. I'm going to divide it into two, as it is there, as individual, and then after that I'll speak about the community. What is effect on us as individual? For example, for us, just when the lockdown time, that's all the children, the schools was closed, and it was very challenging at home. Especially, we want to teach them in order to they send the materials from the school. It was too hard for me in order to teach the children because we don't have the skills of teaching children. Even sometimes the children, if they want to play, it was struggling in order to make them focus and concentrate in the sun. Another thing related to the job, just because I lost my job, I used it to work with NHS as 0-hour contract, so they stop us. So 0-hour contracts, you don't be paid, you don't get paid unless you work. So it depends what work you provide, then you'll be paid. So it stops. So it affects me as well in the job and our income. This is what can I say in the individual level. But if you want, I want to speak about the community. Just the community, we can put it into three categories. Just we have financial problems, we face financial problems. Also, we face our services. We were not providing services, and also getting support. For example, these courses we were attending before in order to get courses that to increase our skills or to get to attain new skills and how to manage. So we were attending before in different courses. So we lost all these. We didn't get them. Especially the financial crisis affects our also members, those that were paying for us the contribution every month. Some of them, because they lost their jobs, so they cut it or they reduced the amount they were paying. So the community was struggling at that time. Okay, the services were not providing any service because of the lockdown. No people coming there, and because we're getting some, we generate some income from the community as well. When people come, they drink or eat, so they pay. They afford. They pay for other for what the service they get. So this one also we lost it because of the lockdown, and also our families. They were the women just they used to meet every month, once a month, to do their social activities and different stuffs. So this one also stops. So we can say it was totally disabled. We can't do anything because this a lot have been affected a lot. So these the financial problems we faced, the services, and also the to open and close in a daily basis. We use it to, as I mentioned it, we use it to open it in a daily basis. So this all is affected us. And I'm going to speak what later. Let us speak about the challenges now, about the solutions we try to do in order to address these challenges, and chance for others in order to speak. Thank you for listening.
Okay, so are we done with the first point, or do we have others to speak on the first point, on the challenges COVID-19 had on us as a person in the community?
I think let them speak. Yeah, give them a chance.
All right. Okay. So, Mahmoud, do you have to say anything? التحديات يعني
تحديات ممكن تتكلم عربي محمود.
You can speak in Arabic. We could somebody could translate it, no problem.
All right, okay, Azadin, I'll speak.
Yeah.
يعني المشكلة اللي قاعد نقابلها حسي مع الكوفيد 19 زي ما اتطرقت فيها انت، الواحد مع الشغل مع شغله وكل شيء، وزي ما اتطرق فيه شيخ عبد الرحمن، يعني قاعد نعاني كثير. الناس حسي اللي كانت تشتغل من شغلها وقفت، والناس اللي شغالة كمان ما للدرجات دي كلهم. فنحن قاعد نعاني حسي زي ما قال من قلة ما قادرين ندفع يعني إيجار المحل يعني. أي واحد زمان كان بيدفع له 20 باوند كل شهر، الزول لما جيت من الشغل ما عنده أي شيء، حتى لنفسه ما حيقدر يعمل حاجة يعني. فدي يعني عوامل كثيرة قاعد تقابلنا. وفي نفس اللحظة كمان الواحد مرات شوية يفرغ بعد ما يجي من الشغل، يرتاح له، ممكن يمشي يقعد يقابل أحبابه وصحبانه وكده. باللحظة دي كمان ما قاعد نلاقيها يعني، المكان مقفول وكده. وبالنسبة كمان لأولادنا ذاته، للأطفال بتاعنا، ما يعني اتحبسوا في البيت. ممكن زمان الواحد يطلع بهم ويمشي على الكوميونتي كل أسبوع، في نهاية الأسبوع قبل الكوفيد 19 يعني. فالفرص دي كلها يعني حسي من ما جل الكوفيد 19 ده كل شيء انعدم. فيا ريت يعني الواحد لو بيلقى له مساعدة ولا أي شيء يعني. هذا الدار أقوله أنا.
Okay.
Then you can go ahead. Can you translate that?
Okay, تمام. طيب. So I think, if I can summarize what Mahmoud said, like in 3 sections. So the first, he did mention about
لا
I mean, different people had lost
قاعدين
their job.
يكركبوا قاعدين يتكلموا.
I think Mahmoud did mention about the fact that there are so many people who had lost their jobs due to this crisis. As a result, they were not able to pay their monthly contribution to Awate Center. As you all know that we don't have any external funding to pay our rent at Awate Center, and we are self-funded, and our monthly rent comes from our community members. And if there's so many members of our community that lost their jobs due to this crisis, and as a result, we're not able to pay our monthly contribution, and that will automatically have an impact on how we run the center. And there is a fear that we might close this center at some point because of lack of money, and the fact that we don't have enough funding to secure our rent. So the second bullet point that Mahmoud had mentioned is the fact that a community we used to all come together and run events like meet and greet. We used to meet people from different backgrounds and all walks of life. We used to provide some support and services to outsiders. However, due to this crisis, we're not able to do that, and that had an impact on our mental health. The fact that we don't meet people from other households. The third point that he mentioned is the family, the family center, the family support that we used to have. We used to run family events, and now due to this COVID-19, as we are not allowed to socialize and meet in one place, we don't have the privilege to meet other family and speak to each other and listen to each other. I think I tried my best to summarize what Mahmoud had said, and if I miss anything, you're all welcome to add.
Thank you, Azadin.
Right, Abdul Hafiz, if you are there, if I don't know, if you can maybe give us your input on what you think the challenges are due to this crisis and how it impacted you as a person, and also as one of the founding members of Awate Center. How do you think this crisis had impacted us at the center? If you guys want to say something about, so we discussed in the first bullet point on the document, what challenges has COVID-19 caused on you as a person and also as a member of Awate Center. If you have anything to add to this conversation, you're welcome to do so.
Yeah, this I think I can say like this is a big crisis the world and affect everyone, everybody, and I believe I affect my family and my relative. I can't visit. I'm alone. Just can't speak in the about meeting in telephone or something like that.
Yeah.
But not allowed in a community. You have something like you thinking more because you're alone. You can talk to someone immediately, face to face. That's that's affected, and as well my wife before they meeting together with another family together, all ladies in the house, the community, they meeting, they join us and make laughing and eating food, music. They have a nice time, but now it's stopping.
Yeah.
For this time, yeah, and everybody have same situation. When I have a not a job, I'm not working. I can go there and playing and staying and reading and studying and talking, playing game, watching TV, watching football. You can do many things when you have a time to join people. That's nice, and I hope so return back soon. I hope so life is gonna back again and everybody can be happy again, because now you can be happy together when
Yeah.
you meet
when you working together and speaking together, you make your life happy and more happiness as well. I s- and that's all I can say now.
Yeah, thank you, Walid. Thank you for your input. That's helpful. So if I can just give you like a leading, a point that could help us to maybe to enrich this discussion. So have you, in the past like 8 to 9 months, have you encountered an issue where you had like, an issue with your teeth and you had to call your dentist? I mean, was it okay for you to book an appointment with your GP? How was it? Do you have any example where you had to call your GP for, if you had anything, and then they said, no, we couldn't, treat you as a priority because we have already existing COVID-19 patient. So if you have an example where you had to call your GP and you don't get the appointment when you need them, you're welcome to share your experience.
Yeah, yes, yes. Thank you for giving some directions. Just you remind me by this the GP appointment. We are not getting access to the GP, and they don't allow you because of the restrictions or the guidelines that the government set up. So, for example, we have a repeated prescription, and it was taking long time than the normal times, than the usual times we take. So several times now it is coming on time. Even you have to write down in a piece of paper and bring it, put it in a box, then you leave it. Normally it takes 2 days before, now maybe taking about a week in order to issue the prescription. Then after that, also in order to get it from the chemist, taking time about a week or 10 days. Before just in total we were taking it in 1 week. So these kinds of things as individual have been affected from that.
Yeah.
Thank you.
Thank you.
Can we go to the second point?
Yeah, we could discuss the second point. We spent an
Yeah,
hour
then
on this one.
If
So
you have any, then after that we can add it up as well.
I think
relating to the first point. Yeah.
So I think I can read out point number 2, and then I can translate it to Arabic to maybe to make people understand it more, and then we could go into discussion if there is anything required. طيب. So I think point number 2 is talking about it says what is being done to help you and your community address this challenge. We have spoken about challenges in finding a job, in losing your job, in not being able to meet people from other backgrounds or to have that family sense and that family connection. We did also speak about issues with your GP and your healthcare provider. What has been done to help us as a community to address those challenges? Do you think we got the support that we need from from groups that support others during this period? طيب هي السؤال الثاني بيقول شنو يعني. طبعا احنا يعني سالفه التحديات طبعا بعد ما جاء الكوفيد 19 والناس بقت تعاني. يعني في ناس فقدت شغلها ما قاعد توظف، في ناس مثلا ما تواصل مع الدكتور اذا عندهم مواعيد مثلا ما يقدر يلاقي المواعيد اللي عاوزين لانه المستشفيات دائما مشغوله بمرضى الكوفيد 19. طيب وفي عالم كمان يعني كان يجي الجالية عشان يتواصل مع ناس وعشان يقضي وقت مع عالم مختلفة وكذا، وحاليا الفرصة دي مش موجودة. يعني تفتكروا ان احنا كعواتة مثلا كمركز عواتة لقينا الدعم المفروض نلقاه من الجهات الحكومية او من البلدية وكذا؟ تفتكروا ان احنا لاقينا الدعم اللي عاوزينه ولا في قصور او في تقصير من الجهات المعنية بالامر هذا على اتجاه ان احنا جالية؟
شكرا عز الدين. ممكن أبدأ أنا. I'm going to start addressing this issue, how we address the challenge we have faced. I'm going to speak about the community. We didn't get any support from outside, but we try to do some solutions. So we ask the property owner in order to reduce for us the rent. And thankfully for him, we are grateful for him. He cooperated with us and he reduced about $100 50 a month. So it was a great help from him, from the landlord. And second thing we have done is we asked fundraising for some bills we used.
Yeah.
For example, the bills, in order to cover the bills in addition to the monthly contributions. So from our members, and they donate for that bill about £700, and we settled that problem as well. And lastly, just we also applied for the grant from the council, and we're being granted about £10,000, and we try to solve our problem by that. And unless that £10,000 comes as a grant to the center, will be closed. Yeah, so it comes down. Even now we are struggling because we mentioned it before. In order to cover the monthly rent, it is about 750 we are paying, and about the bills and this stuff, about we need every month about £1,000. So if this lockdown is going to continue, if it is not being lifted, or this pandemic is not ended quickly, maybe we are facing, in order to close this, facing maybe the risk of closing our center, because we cannot afford the monthly rent. So if we don't pay the rent, we can't have a place in the center for what we need from the others. And what should I go to the second thing? What should we do in order? We ask all the people, or those they support, their interest or concern or supporting the communities in order to grow up, and supporting them financially. We need urgent financial support in order to survive. Otherwise, we are in a very high risk for closing our center. Thank you very much.
Thank you very much, Izzuddin. I believe that the community is very, you didn't get any support, enough support for government or for another community, but we supporting with our people or our team. But now COVID-19, they affect people for work as well. Don't forget that one. Everybody now is stop working, and you can't work enough hour like before, and many people they affected for money, and like should government help us more, and we need to do something like we because now stop for a while, for you didn't get any money for people when you come in the community, pay something and blah blah blah, and never get any enough money before you can pay like Pepsi, chai, tea, or anything, and you get little bit money for electricity and gas or water. But I think we gonna do like talk to government or Nottingham Council to help us more and more, because if he didn't support us, we're gonna stop or close our community, like Abdurrahman said. Just that is big problem. We need more people working together to not stop, to working hard to reach our aim. I hope so that all people, if you work all together, we can get what we want. Thank you.
Shukran. Thank you.
Thank you for addressing the issue of the community as a group that we are facing, all of us. And I would like to say, like, we had a lot of plan on 2019 for plan in 2020. So all the plan has been cancelled, and we was like hoping to get for our kids like schools, and even for the adults like a cinema with the British Red Cross. And I was from here. I would like to thank like British Red Cross for their help to decorate our center and to help us and to find like to have the class there for the refugee, for those who are asylum seeker as well. Like if you come there to the center, you see or listen like to too many stories that you haven't even listened there. But some of them, like even they didn't get like from the home office, they're still waiting long for a long time. So that has been on them like effect. And when we sit with them and tell them that, oh, we give them a hope that they can still, or we're gonna get it soon, maybe tomorrow, or that is the way for the Red Cross or the refugee. They came there and they discussed their issue, and we tell them the way that we had before, and they have to do the step by step what you're gonna do, and after that we find for them a solution. And even if we didn't find the solution, we get the solution from others. So other refugee state the Nottingham, and we need more help from the from the host community. We also like grateful that we managed the center in the last 2 years from our pocket. So we still need a lot of development to develop the center and for our kids, for our family to be together, to be unit, and to be strong. So thank you very much.
Shed some lights on the activities we're doing with the Red Cross and how it stops and what we're doing with them and how you've been affected, especially in terms of the weekly meeting for the asylum seekers. If you give some
Okay,
light
yeah.
on that.
So when we started this community, the main aim was to support refugees and asylum seekers, as well as the host community. And we decided to partner with local groups that are supporting refugees and asylum seekers. For example, the British Red Cross. So we had an agreement with the British Red Cross where we had a weekly meet and greet sessions where we invite people from all walks of life to just have a meal and exchange coffee there. In a way, we get to know these people. We introduce our culture, our way of life, and we get to know more from their end as well. Uh, this kind of activities did actually help us a lot in telling Nottingham who we are, and we kind of establish ourselves in a way that we were the center of you know uh, places where people come to spend good time with their fellow friends and family members. However, when this COVID-19 crisis struck, we lost that opportunity. We couldn't run the weekly project that we used to have with the British Red Cross and other groups. And the main reason is those activities require people to come to the center in person and interact. And now, because of this new COVID rules, where we had to socially distance, we were not able to continue with our project. As a result, we lost touch with our fellow host community, and this had like an impact on us at the community, and also uh, as one of the big communities in Nottingham. We were not able to support the people that we used to support normally. So I guess uh, answering the question whether we had the support that we need from the concerned individuals in Nottingham, we haven't had we did get some support, as Abdurrahman mentioned, getting funding from the local authorities. However, we still need support from these groups. We need to maintain, we need to survive this crisis. We need support, and I think that's the reason why we are having such this session is all to get the support that we need from this group. So hopefully at some point when life becomes normal, we'll be able to continue with our weekly project in order to bring people together and in order to promote integration. And that's the sole reason why we founded Awate Center, so that we help people come together and work as one community. I think
Thank you very
yeah,
much,
no,
Azadin.
no worries.
Thanks. Even if just you speak about the event we organized on the 8th of December 2019, yes, about the Human Rights Day, and
Yeah.
these kinds of activities as well, and such like that. If there is anything you want to speak in order to see how far we've been affected, what a lot of
Yeah,
activities we're
I
doing.
think from
Yeah, yes.
like June 2019 until March 2020, we had a lot of project going on. We had the Human Rights Project that was in December 2019. We also had the World Health Day, where we invited an NHS candidate to come in, take blood tests from our community members. And the human rights event was huge. We did invite a speaker from London, where she had to speak about the human rights violations and crisis, and just to make people aware and understand their right. And unfortunately, we were not able to run any project after this crisis start, and the main reason is because people, I don't think people will risk coming to a center where everything is closed. So we did, the impact on us was huge. And those the project that we used to run really did help us, get our name out there, just for people to know who we are. But now we don't do such thing anymore, and we are really, like, we are badly affected by this crisis, and the fact that we don't run our project anymore. So hopefully at some point we'll be able to do that again, but that will require time and patience, I guess.
Thank you very much, Azadin.
Yeah,
Thank
no,
you.
I think we did touch on everything that impacted us at the center, and the challenges we've been facing, and the challenge we're facing, and how to address those challenges.
We're going to give the last opportunity for everyone to say the last word. Then after that, we're going to close it. Yeah.
Yeah, feel free to speak in Arabic, in any language that you feel comfortable, and we can translate that for you. And if you don't have anything, you can have, you can conclude, you can have a concluding word, you can give an advice on, you can give recommendation, and we'd be happy to translate that for you as well.
Yes, I would like to thank everyone that who take part in this meeting, and that we address our issue. And that's nice as well to see you for a long time, that we haven't seen each other for a long time. So that is our first time meeting together in one platform.
Yeah.
So I would like to thank everyone for their time, and I will see you maybe shortly.
Thank you, Muhammad Hussein. So I think, Abdurrahman, if there's nothing to be said by the members, you could maybe conclude, and we could get done with the meeting.
No problem, but maybe some background noise will come. The boy with me. Just I'm trying to conclude. Just we address the issues about what the challenges we have, financial challenge, and the services we provide, and also for the social activities we do in the center or in the community center. So, and we spoke about that. This is a challenge, and the challenge still exists, and we need from all the organizations that are concerned by supporting communities and help them, support them in order to grow up. We need that help from them in order to survive, as I have mentioned before. And about the solutions as well, what we have done from our side, that is not enough. Still, we need the support, you know, just to survive. Then after this pandemic passed, inshallah soon, then we'll see. We open another. Where we knock another doors or gates in order to get help. So what we need is that one. And I want to thank everyone participated today and was take part in this meeting. And first and foremost, I want to thank Sister Tanya Azad from the from the Mojo organizations. They're helpful people and they're trying to help. So just want them to put more and just get for us any support they can get for us in terms of skills, in terms of education, in terms of empowering women, in terms of financial at the moment, what we need. And hopefully we will get what we need from them. And I am so grateful for them. And thank you very much. وجزاكم الله خير والسلام عليكم ورحمة الله وبركاته.
Thank you, Abdurrahman. Thank you. Thank you very much. Shukran.
You are free to go now, guys. And if you want to say the last one, anyone, just conclusion, feel free. If you don't have, we're going to close the room.
لا شكرا عباية بفضل. السلام عليكم.
عليكم السلام
ورحمة الله وبركاته.
شكرا جزيلا. شكرا. السلام عليكم.
Thank you. Bye.